This issue I want to talk about is medical ethics, which includes obviously quite a broad portfolio of issues such as contraception, abortion, tobacco use, substance abuse, alcoholism is an obvious one, sexually transmitted diseases, cosmetic surgery, an increasingly important controversy for all of the world's religions, certainly not just for Islam. Particularly now we get into the really uncharted territory for the religions of genetic manipulation. I see in Harper's Magazine, which I picked up at the airport a couple of days ago, there's a plastic surgeon who is desperate to produce human beings with wings. He says this can be done, he can do it, and why shouldn't the law allow him to do that? And this whole blurring of the whole definition of humanity, which is part of the modern world, the fact that we are less and less established in a pattern into which we've been born, and we change identities, we change jobs, we change religions, we travel, and now we are starting to edit the very fabric of our bodies. It's part of the postmodern challenge to the idea of a human essence, and plastic surgeons are certainly at the front line of that. So I'm going to have a go at this just to indicate how successful Islamic law has been, or how unsuccessful in fielding some of these new and often unimaginable difficulties. There are some medical ethics issues that have been relatively uncontroversial. Perhaps the earliest of the West's vices to hit the Muslim world was tobacco 300-400 years ago. And the earliest fatwas, and in case you think the word means a death sentence, fatwa just means a judgment by a competent Islamic authority. The earliest fatwas, which really rolled around in the Ottoman Empire in the 17th century, said that it seemed tobacco, although it wasn't mentioned in the Quran and the Hadith, was fine. It was halal, or lawful. They couldn't see any reason for it to be prohibited. And there's a principle, particularly in Hanafi law, that says everything is lawful unless proven otherwise. And that was the fatwa, and even the pious could be seen on benches in coffee houses in Istanbul and elsewhere, puffing on those bubbly pipes, and that wasn't regarded as problematic. And that remained the verdict until the mid-20th century, when medical evidence started to mount for smoking being rather damaging to the health. And so we find a new fatwa, again a nail in the coffin for those who say Islamic law is immobile, which actually overrode the earlier view. Sorry, this is 1966. Mahmoud Shaltut issues a fatwa. He is the head of the religious scholars in Egypt. And he issues another fatwa in which he remarks, tobacco is not intoxicating and does not cause damage to the mind. In other words, it's not like alcohol. However, it has deleterious effects to the health of both smokers and non-smokers. Doctors have analysed its elements and identified a toxic constituent which ruins the happiness and pleasure of man. Causing damage is, in the view of Islam, an abomination that needs to be avoided. Amounts of money are spent on it, which very often the smoker could use otherwise in more useful and productive directions. For this reason, smoking has aspects which, in the eyes of the Sharia, require that it be prevented and not permitted. So he goes on to ask the Egyptian government to prohibit the sale of tobacco in Egypt, which the Egyptian government promptly doesn't do. The kind of rather specious excuse that the government presented was that alcohol is legal in Egypt because tourists and minorities demand it, and tobacco is less harmful than alcohol, so how could we prohibit tobacco? So that's a fairly straightforward issue. Once it was considered halal, lawful, then it was considered haram, or unlawful. That's the present position, although plenty of Muslims do smoke, of course. Margaret Thatcher, God bless her, recently spent 4 hours on a stopover in Tashkent, Uzbekistan, in which she clinched a £100 million deal for Imperial Tobacco to build a nice new cigarette factory for the Uzbeks. Unfortunately, the religious prohibition is not widely observed. So, that's one example, and another fairly clear example is the fatwas that have been pronounced on AIDS and other sexually transmitted diseases. And from about 1985 onwards, HIV infection started to impinge on the Muslim conscience. I'm going to push around a map. The rubric is in French, but I'm sure that won't be a problem, which shows infection rates around the world. And it's a map that's not often there in the newspapers, even though it's very revealing. And perhaps I'm being paranoid, but I suspect one reason for that is that it does show that the Muslim world really is a kind of great blank space in the middle. Because of very conservative attitudes to premarital sex and the segregation of the sexes, the Muslim world by and large has been spared the worst ravages of AIDS. The preachers, in their more thoughtful moments, will say that it's not that AIDS is God's punishment for turpitude. It's rather that the Sharia is there to preserve us from the misfortunes that lie in wait for anybody who rejects God's protection. So I think in the handouts I've included a hadith that they very often come up with. And the hadith runs, "Never shall immoral behaviour appear among a people to the extent that they make it public, but that there shall appear among them plagues and agonies unknown to their forefathers." Which seems to indicate the AIDS phenomenon quite neatly. So that's a new social problem, a new medical problem, but one that hasn't really caused difficulties for Islamic law or its adaptation. In fact, AIDS is now a very cliched sermon topic in Muslim countries. However, the story is not always this simple. Let's take a look at the very emotive issue of abortion and how the Sharia has coped with this. Well, of course, abortion is not a new issue. It's as old as humanity itself, and medieval Islamic medicine knew of various methods of inducing abortion. However, it's become nowadays a much more intensified argument because it's much safer than it used to be. Also because there's considerable pressure on a lot of societies to control birth rates. Medieval Islamic law has already got some guidance on abortion. In fact, it discusses it in some detail. All four of the madhabs, the four that I listed, agree that a fetus that has a soul has the same legal rights as any other human being. So that if a fetus with a soul is aborted, that's considered to be homicide. It has to be given a name, a full funeral prayer has to be said over it, it has to be buried in a Muslim cemetery in the usual way. In Islamic law, it can even inherit. That's for aborted fetuses, also for miscarriages. The catch is, how do we define the fetus with the soul? And this is, of course, the controversy in other religions and even amongst the secular commentators as well, who are concerned to define humanity in terms of some definition of consciousness. Most jurists, in fact 3 out of the 4 Sunni schools, hold that we can know the moment of ensoulment, what's called nafh al-ruh, when God breathes the spirit into the unborn child. And this is thought to take place in the 16th week of pregnancy. And they can be sure about this because there is a hadith that indicates this. It's a hadith that runs, each one of you has his creation gathered in his mother's womb for 40 days. Then he becomes a clot for a like period. Then he becomes a piece of flesh. Then God sends the angel who breathes in the spirit. So most medieval Muslim jurists actually have what we would regard as a fairly liberal attitude to abortion, and they allow it. It's not a criminal activity before the 16th week of pregnancy, unless demonstrably it's going to endanger the life of the mother. The phrase that the jurists like is to compare violence against an unsold fetus to the crushing of a date stone. To do so is not equivalent to uprooting a palm tree. It's just a piece of flesh. It's not human until the soul is present. As so often, Islamic law, however, doesn't speak unanimously, and the exception here is the Maliki jurists, who are a little uncomfortable with this 16-week deadline. They say that to base it just on one hadith is, given the momentous nature of the subject, a little bit problematic. And the Malikis traditionally outlaw abortion in most cases. There are also secondary arguments over whether abortion has to have the consent of both parents. Most jurists say that yes, it has to, but the Hanafis, for instance, hold that a woman does have the right to abort her fetus without her husband's permission. Now, once the installment has taken place, an abortion is only legal if the pregnancy manifestly endangers the mother's life. The principle here being the fairly utilitarian one, that the actual life of the mother takes precedence over the potential life of the child. That's the classical position. And given this relatively clear-cut set of answers, which even by modern Western standards might seem to be relatively liberal, you'd expect the contemporary debate to be fairly minor. In fact, abortion has become the subject of a very bitter debate in the past 10 years or so. And we find, interestingly, that some ulama, some Muslim religious studies scholars, are now challenging the classical toleration of it and are pressing for some form of prohibition. Now, the argument is the new one, which is that the easy availability of abortion is going to encourage Western-style promiscuity in Muslim countries. And this is a new factor, and therefore abortion needs to be prohibited, whereas hitherto it was allowed. There's also a possibly paranoid suspicion that the Western countries are dismayed by the population boom in the Muslim countries and are supporting abortion in those countries as an attempt to control this. The fact that the 1994 UN population conference was held in Cairo, the world's most populous Muslim city, is by some seen as a sign of that. So that's an example of how a classical Islamic ruling can be influenced by new factors that are in play. There's another one that frequently is part of the equation, which is that the jurisdictions in most Muslim countries are profoundly influenced by the legal systems of the former colonial powers. And often this is a partner in the debate as Muslim countries strive to figure out their own contemporary laws. So, for instance, clauses 260 to 264 of the Egyptian Civil Code actually prohibit abortion. They more or less overrule the Sharia. They only allow it in cases of rape, for instance. And that's simply a leftover from Egypt's flirtation with French culture, and it goes right back to Napoleon's invasion 200 years ago, the imposition of the Code Napoleon. So you find a complex situation, particularly intriguing in the fact, insofar as the Western influence in this case, or the threat of Westernization, has actually pushed the Sharia in a more conservative direction rather than forcing a liberalization. And the new arguments are very diverse, and there's no real sign of a consensus. Generally speaking, it's accepted that fetuses that are known to be physically or mentally handicapped can be aborted before the 16-week cut-off. That's the official fatwa that comes from Al-Azhar now. It's 3 years old, that's their position. But the classical jurists would have regarded that as unnecessary. It's not a sin, it's not a crime to have an abortion before 16 weeks anyway, unless you're a Maliki. Other transformations have taken place in attitudes to contraception. And again, here we have the ironic spectacle of a historic Islamic liberalism or toleration actually transformed in a more conservative direction because of an impact with the West. Medieval Muslim scholars generally tolerated contraception, although they frowned on methods that were regarded as being damaging to the health, or abortifacient methods that work by displacing the fertilized egg, which weren't forbidden but were regarded as reprehensible. The arguments in favor of contraception cite a number of hadith in which the Prophet authorizes the use of, for instance, coitus interruptus. But interestingly, these tend to be deployed as a kind of supporting evidence. The greatest medieval Muslim thinker, who we'll return to next time, called Ghazali, dies in 1111 of the Western calendar, and is really the source for most of this argument. Seems to ground his argument mainly in the medical and scientific knowledge of his day. He says that according to medicine, the human shape, the human entity, really only takes shape following fertilization. So to destroy a male or female seed simply has no significance. And that contrasts with medieval European understandings for two reasons. Firstly, medieval Islam valorized sexuality, whether or not it led to reproduction, unlike the classical Catholic position, for instance. Also, medieval Islam, for various historical reasons, had inherited a particular aspect of the Greek patrimony that was associated with Galen rather than Aristotle. And Europe, particularly Aquinas, followed Aristotle. Galen held that the human creature comes into being upon fertilization, and that before then you just have a piece of flesh from the two sexes. Whereas Aristotle held that the human being is contained in miniature in the sperm of the male, and hence following that argument, medieval Catholicism assumed that anything that prohibited conception was akin to homicide and was thwarting God's purposes. So, for instance, we have a hadith from the Prophet that the jurists often cite that seems to reflect this. The Prophet said, "Man is created of both, the semen of the man and the semen of the woman. The man's semen forms the bones and tendons, the woman's semen forms the flesh and the blood." Now, as well as these medical arguments, Islamic law also recognized what we might call economic and social arguments in favor of contraception. For instance, we find if a man wishes to avoid impregnating his concubine because of the added expense of a child, he can use contraception. A concubine, unlike a wife, doesn't have the right to refuse contraception. There were social arguments as well. For instance, some jurists held that if a Muslim was outside the Muslim world, then contraception was actually obligatory for fear that the child would fall into the hands of unbelievers. So these are the medieval arguments which have shaped the modern controversy, which has taken a very different shape in different Muslim countries. In most Muslim countries to this day, contraceptives are freely available. In Iran, for instance, all you need to do to obtain free condoms is to brandish a marriage certificate in the pharmacist, and you'll be given them. However, in some Muslim countries, particularly in Arab countries, there's been a shift away from the relative toleration of the medieval period, again because of the new factor which claims that the ready availability of these things is going to promote Western-style promiscuity and hence the breakdown of the family. Another example of how interaction with the West can actually push Islamic law into a conservative rather than a liberal direction, as those terms would be understood by Westerners. Number of other issues that I could deal with. Let me talk a bit about artificial insemination, partly because this is a much more unfamiliar issue to the classical jurists, and of course is, for us in the West, major controversy as well. Muslim world, this is a particularly hot topic because fertility is very highly esteemed, as it is in all traditional cultures. Infertility is really a calamity that challenges one's place in the family, in the family tree and one's pedigree, also depriving one of children who might help till the land and care for one in old age. Traditional Muslim societies did recognize that infertility could be a male as well as a female problem. So we find in a hadith, the Prophet reproaches a man who had not informed his wife of his sterility prior to marriage. And the hadith goes on to tell us that the Prophet then gave the woman the right to divorce him if she chose. The desire for fertility also intensified by the fact that the Quran prohibits adoption. It recognizes fostering as a virtue, but it prohibits adoption, and that's the position in Islamic law. The reason being that because genealogy is so important to the Muslim imagination, and that people always have the right to know their own parentage and their own family, tribal, regional, whatever affiliation, that it is a deprivation of the child's rights to bring him up under a false name. So fostering is a virtue, and of course the Prophet was an orphan who was fostered, but adoption is prohibited. So, a lot of interest as a result in fertility treatment now in the Muslim world. And the ulama, the Muslim scholars, we don't have priests, but we have ulama. It just means those who know, the learned, have worked overtime to try and figure out whether these new methods, in vitro fertilization and the rest, can actually be allowed. Now, two basic principles are commonly invoked as these Muslim scholars seek to extend the Sharia to, for instance, in vitro fertilization methods that have been increasingly available. Surrogate parentage following the Baby M case in 1986 and so forth. Two basic principles are invoked. Firstly, classical Sharia textbooks acknowledge the possibility of penetration, of pregnancy without actual physical penetration. They say that's possible. Secondly, the jurists recognize that there is no Quranic or Hadith text that suggests that conception is only religiously sanctioned if it takes place in the normal biological way. And they assume that bringing about pregnancy through a means other than sexual contact is not an interference in God's purposes or an attempt to change his decision that a given couple are not going to have children. The egg and sperm are God's creation, and how they come together is not really regarded as terribly significant religiously. And after all, if God wishes a couple to be infertile, then they're going to be infertile, whatever means they attempt to employ to get around his decree. And using these two arguments, the view over the last 10 years has generally been that artificial insemination is lawful. But there are three conditions. Firstly, the sperm has to be the husband's. Secondly, it has to be transferred to his own wife before or after fertilization. And the third is that they are neither divorced nor separated. Artificial insemination from a sperm bank is viewed, as far as I can see, universally as even worse than adultery and is completely forbidden. Another interesting issue is what happens if the husband is deceased? Can the wife still demand this sort of treatment? Quite recently there was a landmark case in England where an English woman was actually denied by the courts the right to be inseminated with the seed of her husband who had died young. Eventually on appeal that was overturned and she was allowed to do it. In the Muslim world again, this has been debated, and to date, as so often with these new issues, there is no consensual position in the Sharia. In 1988, however, there was a fatwa from somebody called Sheikh Abdul al-Murshid in Egypt, stating that a woman does have the right to use the genetic material of her deceased husband in this way. The argument was complicated. He came up with a lot of scriptural proof texts and arguments from the rights of a spouse. This wasn't unanimously accepted. There was a lot of opposition, particularly from some who sought to prove that only a young woman should have the right to use the seed of her deceased husband in this way. It was also thought that widows might use this method as a kind of poetic gesture of fidelity to their late husbands, rather than really considering the kind of life such a child might lead. It was also noted that the Islamic law of estate division is really complicated by this, because the child is born after his father's estate has been divided and given away. So in a sense, the child is disinherited. And on that counter-argument, many scholars have said, well, posthumous insemination isn't actually legal in Islamic law, or only under very special circumstances. So an example of a radically new issue that is being debated and on which there still is no consensus, but where clearly we are not just dealing with the abstract hair-splitting manipulation of scriptural proof texts, but where there is a genuine human concern for the rights and the human flourishing of the people involved. Other questions that I should tackle briefly before we move on to some questions. Sex changes prohibited, not least because the Prophet himself was concerned to maintain gender polarization. He said that God curses men who seek to resemble women and women who seek to resemble men. And it's a feature of Islamic societies generally that men are admired when they are virile and women when they are feminine, according to the traditional categories. Of course, things are never quite that clear-cut because a certain percentage of children are always born in a kind of grey area as hermaphrodites, and the medievals spent quite a lot of effort trying to determine how you actually determine the sex of a child born with such an affliction. But as far as I know, there is no Islamic authority that has yet delivered a fatwa legitimizing a transgender operation of an adult. There was a celebrated case in Egypt in 1988 when a medical student called Sayyid Abdullah actually was convinced that he was a woman trapped in a man's body and persuaded a surgeon illegally to carry out the operation. And the student then changed his name. He chose a Western name, interestingly. He called himself Sally, which, again, for the conservative press, indicated that this is a sort of westernizing form of decadence. And the Mufti, the authority competent to deliver fatwas, who was called in to decide on this case, decided quite rapidly that this was not a sex change at all. This was simply a form of forbidden mutilation that also entailed a self-sterilization, because Sally was now incapable of engendering children as a father or as a mother. So for this view, the surgery did not solve a problem but actually created one. He was now some kind of mukhannath or hermaphrodite, whereas previously he had been legally male. Another number of other medical issues I could deal with, particularly those involving the arguably insoluble question of genetic manipulation and the implications of that. A friend of mine who is a genetic scientist in Cambridge, for instance, says that one thing he'd really like to do when human cloning is allowed, which he reckons will be in about 5 years, will be to take a sample of the DNA from the figure on the Shroud of Turin and to clone that individual. And he says, aha, this will be the second coming. You will have that individual born as a baby and you will see Jesus Christ, or whoever the individual represents on those serum smears that are there on the shroud. That's just an example of the very difficult, possibly insoluble arguments that modern science is beginning to present to religion, interrogating the most fundamental assumptions religion traditionally has had about what constitutes a human being. And it's far from clear what fatwa will eventually consensually emerge on the legitimacy or otherwise of this hitherto unimaginable form of manipulation.